A lot of us wearing red, no coincidence. It's the start of American Heart Month. It's also National Wear Red Day. We're going to talk to some local experts about heart health every week this month. This morning, we're joined by Dr.
Naila.
Thank you, Naila. I practiced and I still got it wrong. Choudhary, a cardiologist at the Sands-Constellation Heart Institute. So yes, we have our red. That's step one.
Yes.
The steps after that so much more important because it's learning about our health, it's learning about our risk factors, and maybe let's start with we focus so much about the men in our lives often, not really caring about ourselves, and the symptoms that we as women are having problems might be different than men having heart problems.
That is very correct. I think I will start off by saying that, many women ignore that heart disease is #1 killer for women in the United States. Heart disease presents very differently, especially heart attack symptoms can be very different in men compared to women. Back in the 1970s, all the commercials that you would see is a man holding onto his chest.
Right.
And, walking in the cold, those kinds of symptoms. Well, women present very differently. For women, it's mostly atypical symptoms, meaning, yes, the chest pain, kind of holding onto the chest, is the most common symptom, but there are many women who will just present with, for example, nausea, or just like some neck pain, or back pain, or jaw pain. And there are many women who just have shortness of breath and might not have any chest pain. Wow. So it is very important for us to educate our women that, the symptoms of the chest pain can be very different between men and women. And it is our job as healthcare providers to recognize those symptoms so that we can manage them accordingly. And
you mentioned neck pain and back pain. I mean, it's not uncommon for you to wake up and have some pains, but how does that pain present?
So, for example, if you, there's neck pain and back pain could be just musculoskeletal, especially as we age, there's more arthritis in the neck and, as well as in the back. But, the heart-related symptoms, kind of neck pain that is more on the front of the neck with radiating to the jawline. This is the kind of the pain that is going to come out of the blue that you would never have it before. The kind of the pain could be more like a tightness feeling or like a pressure-like or a choking sensation than just like a dull muscular pain.
Okay, if we have some of these, I imagine we need to go see someone like you right away.
Yes, you should not, I tell my patients, if you have any of the symptoms that would suggest a heart attack, don't waste your time calling your primary care doctor or your cardiologist. This is a time for you to go to the emergency room because, when the heart attack comes, time is muscle. The more time we're going to wait, the more damage happens. So, when you have these symptoms, you should immediately seek care in the emergency room.
We're so into finding out more about our genetics these days, right? All these kits you can send away from. But knowing your heart history, your family history when it comes to this is quite important as well, right?
That is correct. There's several risk factors that get involved. Women, there are certain risk factors that cause more damage to women. For example, not only the genetics, but for example, smoking. Smoking causes more damage in the woman and leads to more heart attack and stroke than it would in men. Of course, it's not safe for men to smoke either, but it causes more damage in women. Same thing for diabetes. I tell my diabetic patient, my hypertensive woman, that you have hypertension and you have diabetes, you have to really work hard to be heart healthy compared to women of the same age group who do not have diabetes, who do not have high blood pressure, who do not have a family history, for example. So it's very important for us to not only work on our lifestyle, try to eat healthy, try to exercise every day. Current recommendations is exercise about 30 to 50 minutes for about 5 to 6 times a week.
Right.
So we need to find time for ourselves to take care of ourselves and our women to modify several of those risk factors because women need to work really hard, especially if they have some of the risk factors going on, for example, diabetes, hypertension, a history of stroke, things like that.
Wow. So again, wearing red day is just the first step.
It's just the first step. There's more that goes into just wearing red. But again, wearing red is a reminder that we should educate not only our men, but also our women about what are the risk factors for heart disease, what are the symptoms that we need to watch, and what are the things that we can do to modify all those things. So that's really very important.
Wow. All right. So thanks for explaining that pain too. I've always wondered, you hear pain, but what does that mean? Nice to meet you. Thanks for coming in.
Thank you.
And again, we're going to continue this discussion all month long.